Hello, my name is Laura Pedreros. I am talking about the anti-inflammatory and antioxidant potential of herbal supplements. Identify tissue targets in addressing obesity and metabolic disease. Definition: medicinal plants are considered cheap and safe, which is why they are gaining attention for their anti-inflammatory and antioxidant action. They are composed of nutritional substances, mainly physical chemicals, with the potential to restore and maintain the balance of the body system. Different investigations have reported the use of the medicinal plants as a remedy for metabolic disease.
I'm Jennifer Ray, and in this series I aim to provide accessible, empowering, and inspiring high-level health strategies. It's my belief that conventional medicine doesn't always address our health concerns, and we need to start turning towards natural remedies and earth-based medical systems that have long histories in order to find more solutions and support. In particular, in this series, I focus on herbal medicine, food as medicine, and daily habits. So join me for the series and take your health into your own hands. In today's video, I'm going to discuss the body's pain response and inflammation. Chronic pain can be so difficult to deal with. So whether it's shoulder pain or knee pain, back pain, joint pain, maybe it's menstrual cramps or headaches or pain due to IBS, we can find natural solutions to help really support us in that situation. So listen in to learn what you can do. When you experience pain in the body, it's oftentimes due to inflammation. The body creates an inflammatory response in order to make you turn your attention towards an area that needs your awareness. Pain is definitely a signal. An injury or imbalance of some sort is causing inflammation, which then leads to pain. So your first step is to really step back and give yourself an opportunity to heal. And also you want to pay attention to what is the underlying cause, of course, of the pain. So if you continue to aggravate the inflammation with further activity or triggering behavior, the pain and inflammation, of course, will continue. Inflammation doesn't just happen on its own. It happens and it gets worse due to a disruption in the body's immune system response. So contributing factors can be things like poor sleep and stress, a sedentary lifestyle or poor posture, past injury, nutrient deficiencies, adrenal or hormonal imbalances. It can be due to things even like chronic viral infections, to name just a few. You can think of the body's inflammatory response like a fire. If left unchecked, it can lead or cascade into a whole series of more serious inflammatory conditions. As always, it's important you receive a proper medical diagnosis, especially if the pain is chronic or severe, just to rule out more serious conditions. Pharmaceuticals are sometimes a good option for temporary relief, but when taken regularly, they can actually lead to more serious conditions. So studies show that NSAIDs, these are the medications like ibuprofen, can cause things like stomach ulcers and even gastritis when taken for as little as 5 days in a row. So because of this, it can be helpful to use more natural remedies for relief.
Application in nutrition. There either is evidence the inflammatory processes are modulated by regular intake of food and diets rich in the phytochemicals, with proven anti-inflammatory effects. Target studies with high-risk patients and diets high in fruits, vegetables, and whole grains. Supplements with EPA rich oil can significantly reduce the production of the inflammatory biomarkers.
If you're somebody that's been recently diagnosed or has an inflammatory disease process and you're looking for some answers, there's not a lot of things out there, not a lot of cures for those diseases, so you're looking for something that you can do on your own. Saturated fat is probably the biggest thing that you can modify in your diet in order to make a difference. And saturated fat is found in animal foods primarily. So you're going to find those in any of your beef, fish, chicken, poultry, turkey, and then also in dairy products. Right now in the United States, we are choosing a lot of omega-6 fatty acids like soybean oil, sunflower oil, and corn oil as refined products. We're getting our omega-6 fatty acids from things like crackers and cookies and sweets and processed foods. And those are areas where we need to start to back away from and really make better choices, choosing whole foods, foods that exist in their natural state, fruits and vegetables, whole grains, pastas, things like that. And then also legumes are a great source of protein, and that can replace some of the saturated fat and the protein that you would eat from animal products. So shifting the ratio overall is what people really want to do. Now, omega-3 fatty acids can be found in things like salmon. We hear a lot about salmon and trying to choose different sources of protein. But choosing the salmon as frequently as recommended is often not practical. So we also want to try to choose olive oil and cook with that versus canola or corn oil, and really start to look at other sources of omega-3 fatty acids and moving that up at a higher percentage in our diet, and then those polyunsaturated omega-6 fatty acids that are refined, like in the crackers and cookies and processed foods, down in our diet. The best place to look is to look on the internet or in your bookstores for literature that is written by a registered dietitian and or a medical doctor. So they're going to have RD or MD after their name. And that literature is going to be based in science, it's going to be evidence-based, and it's really going to give you the best, most sound information that you can use.
Pros and cons. Pros. Promote homeostasis by maintaining a balance between inflammation and anti-inflammation. Promote the reduction of cardiovascular events, cancer and chronic disease. Increase lipolysis thermogenesis. Improve red fluid retention. Interference with fat absorption. Cons. Limited energy intake from total fat and sugar can cause anxiety of the not evaluated by a professional.
One of the best ways to reduce inflammation in our body is by the foods that we eat. So one of the things that causes inflammation is processed foods, foods that are high in fats, foods that are high in sugars, for example. We're on the road a lot. We're trying to find that quick and convenience food, so foods that have been sitting on the shelves for a long time, things that are packaged and ready to eat. So instead, we want to try to bring back the plant-based foods, foods that are naturally found in the environment. They give you oxygen, so they reduce those free radicals. They're high in antioxidants, so they're full of vitamins and minerals that are very important to fight off that inflammation state that can occur in the body. The best way to get in those plant-based diets is, and especially when you're going shopping, is to stick to the perimeter of the store. Shop around the edges and avoid all that stuff in the middle where it's all the processed packaged foods that are ready to eat. And the best way to make sure that you're using your fruits and vegetables so that they don't go bad is planning your week's menu options of what you're going to be cooking and using the things that are going to go bad first so that you don't have a lot of waste at the end of the week.
Issue applied in Ecuador. In Ecuador, diets and treatments have been found that are a risk every day to fight obesity. The use of medicinal plants, however, it is best to put yourself in the hands of a specialist in this field to receive a correct advice according to personal needs. Medicinal plants and the products obtaining from them are effective remedies to combat obesity, as they do not have adverse effects. Notwithstanding, the treatment must be combined with a change in eating habits and physical activity and should not be used irresponsibly. Thank you.